Hello everyone and welcome to a new episode of Eden Health Podcast. We want to understand the modern technology, how to detect the heart problem, how to monitor the health, and of course how to choose the right test for each patient. And today I'm with very pleasure I will welcome our Dr. Erick Silva from Cuba. Of course you are speaking Spanish. This is your native language.
Yes.
So I'm trying to try your language in the beginning. Bienvenido, Dr. Erick.
Oh, un placer para mí.
¿Cómo estás?
Todo bien, todo bien. ¿Cómo está usted?
Muy bien. This is this is my level.
It's very nice. He speaks Spanish very good.
Yeah. So I want to ask in Spanish.
Okay.
¿Por qué decido trabajador en cardiología?
Bueno, pregunta interesante, ¿no?
Yeah.
You want me to speak in Spanish or in English?
Try. You know Arabic?
شوية شوية. أنا أتكلم شوية عربي.
حابب جملة in Arabic. How you introduce yourself in Arabic?
No.
Yeah.
اسمي دكتور إيريك استشاري القلب من القطر. أنا في شغل الحين من
قلب أو كلب؟
قلب.
هذا ريد
قلب. في شغل من المستشفى اليدين. إن شاء الله أنت في شيء tal. أنا أشوف كل شيء القلب. Bueno, es interesante, ¿no? Y curioso la decisión por qué me convertí en cardiólogo, ¿no? Cuando era pequeño, tenía 5 años, yo siempre me gustó la ciencia, la medicina, y desde ese momento en la escuela con mis compañeros de estudio me gustaba comparar mis latidos cardíacos, el pulso con mis compañeros, y detecté que había una diferencia respecto a mis compañeros conmigo, iba muy rápido mi corazón. Y entonces eso lo llevé a la familia y en aquel tiempo, bueno, la tecnología no era la misma, las cosas no eran iguales. Y mi mamá me llevó al médico. Y sí, había algo, había un soplo funcional. Entonces este soplo funcional, el médico me dijo en aquel momento, no, eso es temporal, eso se quita, no hay problema con eso. Pero bueno, yo seguí con el tema de que comparándome con mis compañeros y esto, y seguí diciéndole a mi familia, pero mi abuela era una persona muy dedicada, muy atenta, y ella siempre le dijo a mi mamá que me llevara hasta una vez que me vio un médico muy famoso allá en Cuba, y ese médico muy famoso me diagnosticó, es decir, me convertí en paciente, y desde ese momento yo dije que iba a ser médico, que iba a ser cardiólogo, y nunca en la vida he tenido nada, gracias a Dios, que me detenga en ese camino. Y mírame aquí, contigo, aquí, cardiólogo ya en Qatar. Fui cardiólogo en Cuba, fui cardiólogo en Kuwait y aquí en Qatar también.
Perfect, really. Yeah. So let's continue in English to everyone they can follow up.
Okay.
Yeah. So, doctor, before any discussion about the machine and the technology and everything, I want to share with also the spectacle some important number from Qatar. You know, in Qatar we have the population, some statistic, hypertension, we have 24.3% they have hypertension, and also 80% they have diabetic, and obesity is 33.4%. So approximately, we have 1 in 4 people they have hypertension, 1 in 5 people they have a diabetic, and 1 in 3 they have obesity. So when you heard this number, and as cardiology in Qatar and Cuba and Kuwait, so what's the concern about this number?
Well, in our medical science and terminology, all what we do is taking into account level of evidence and functional class. I mean, like classifying the patients, epidemiology, like that. All this, when you approach Qatar, as you say very well, it's clear this country, because the lifestyle and all the things that people are doing because of the culture, the incidence of hypertension and metabolic disease, even heart disease, is very high because of that. From cardiology side, what we do, we implement strategies to prevent. Prevention is the most important thing because already you have the problem. Then the most important thing is teaching the people what is the proper food to eat. I mean, lifestyle. The first line of action is lifestyle modification with the diet, with some exercise when the patient need to do proper exercise, because if you do exercise not in the proper time, will not produce the same result like when it's proper to do it. I mean, because muscle stress will, for example, will increase the insulin resistance and will change all things. Then risk stratification is the most important, and teach the patient lifestyle modification. After that, if there is proper diagnosis of hypertension or any cardiovascular disease, something important to take in account is any problem for, I mean, like a hypertension, there is cardiac and non-cardiac cause. And when you are coming to see, for example, any doctor or cardiology specific, we cannot take only in consideration, I mean, we are not assessing the patient only for cardiology. No, we have to take in account all the elements, cardiac and non-cardiacs. All the things the patient can share with you about his lifestyle and is very important. And we can start a program together to modify all these things according to his health. And after that, if there is established, I mean, we diagnose already hypertension or any heart problem, after that, if the patient needs medication, and even after some time with lifestyle modification, the patient continue with the same issue, because there is something also basic. Sometimes the patient with the lifestyle modification improve and finish. And the problem is solved.
Everything is silent.
Yes, but sometimes, for example, look, hypertension, for example, one of the most common diseases, can be silent presentation. And mostly of the patients, they have hypertension, but they didn't feel anything. And this is an issue, because maybe you have very high blood pressure and you can develop a stroke, heart attack, a lot of complication, and you didn't know. And then sudden complication can happen. And in cardiology together, for example, there is special populations, they develop heart disease without pain, asymptomatic patient. We call it in our terminology, silent ischemia. For example, I will give you some example. Diabetic patient, they can develop heart attack, ischemia without pain. Athletes, a patient who use alcohol several times, chronic kidney disease, obese patient, elder patient, patients with polyneuropathies, patient with all diseases like leprosy patient, they can develop. Patient with heart transplant also they will develop. And that is why it's very important from the general and cardiology together point of view, get very good risk stratification about your health condition. Not only because cardiology or go directly, no. One time you go to the doctor, check all these things is very important to avoid sudden problem or any heart condition, I mean, like a complication or heart attack or a stroke, and will be asymptomatic in this case, Then it's very important go to see the doctor, cardiology, to have the risk stratification to avoid all this kind of issue.
Yeah, doctor. That's why I start with hypertension, obesity, and diabetes, because a lot of people, they think, for example, as me, as a young, if I don't have hypertension, I'm not a diabetic, and I'm, for example, I'm not fat. So I think no need to check my heart. This is how we think. But no, sometimes I know a popular story of a football player. He's an athlete, so he have a good health, but sometimes he have heart attack. So and a lot of people in Qatar, they will not go to cardiology until they feel chest pain or they have symptom. So I want to know when exactly I need to check the cardiology, even I don't have symptom.
Basically, any kind of patient with all these conditions I mentioned before, like you can have hypertension, you can be diabetic, you can be obese, even over 40s, 50 athletes, patients who use alcohol, polyneuropathies, kidney disease patient, all this population, they have to have a general and cardiovascular assessment to prevent this issue and make risk stratification. But any kind of patient, he want to know the function of the heart. I told before this mechanical and electrical function. Then the only way to know the heart function is doing echo and ECG, basically at the beginning, and maybe we can detect something, or maybe there is nothing.
يعني can have normal ECG
Yeah.
but abnormal in echo.
Yes, also.
Which case is this? يعني?
There are congenital heart disease. For example, children. I'm not taking care about only for me is over 14 years old. But for example, the children heart is different, totally different than the adult heart because it's in development. Even the electrical system is different. Then there are some kind of patient. They have like a persistence of the childhood pattern in the ECG. And even there are some things in the mechanical function will be persistence. I mean, will have persistence, will stay for more age. Normally, over 20 years old, all the heart must be development, you know. But it can be possible, why not?
And this is a powerful example. يعني. This is why I need more than machine. Because this is normal and echo is abnormal, so we can discover more disease. So let's continue now to the Holter. Okay, for me, and a lot of people, they think the Holter is same ECG because it's tracking, but for 24 hours, it's like ECG but at home. So, but what is different between a patient come here to make normal ECG, then to make Holter with him for 24 hours or for 48?
The time and the possibility of document the problem the patient refer. This is the key. I mean, because sometimes, as I told you, you will do basal 12 lead ECG, which take maybe 10 minutes, 15 minutes. But at this time, you will not catch the issue. You will not catch the problem, the electrical problem, you know, for example. The patient is saying, I have palpitation, but at this time, you are doing ECG. There is not palpitation. Then will be normal ECG.
Oh, yeah.
Then if you make 24 or 48 hours, you have more window to try to catch the problem the patient, and even the patient will go to develop his normal lifestyle things. Sometimes some events are coming in a specific things you are doing, you know. Then that is why I tell the patient, go out, do your normal activity to try to catch. And we are doing very well. I mean, we are detecting and documenting supraventricular tachycardia. Even this electrical system of the heart sometimes have extra leads. Sometimes there is like a genetic issue are coming with anomalies, and we detect because of that.
But he can do a stress test here. He will do the exercise in front of you better than he will go home.
This is different.
Yeah.
As I told you, we can make resting electrical activity documentation with ECG. We consider even resting if you go with Holter 48, 24, 48, 72 hours. But we have other choice. For example, like when we do ECG stress test, we can assess several things. We can assess the electrical activity of the heart, resting and with exertion. Exertion is equivalent to stress.
Okay.
We are inducing stress through exercise to check the electrical activity of the heart. But also we will get if there is any, because all is integrated. A heart has arteries and flow inside. And if there is a decreased flow perfusion, I mean the oxygen is not getting proper to the electrical system to work, it will come problem. And we can detect even mechanical also with in this case of stress, you know. This is one of the gold standards before and complemented with other tests for sure to detect coronary artery disease, for example. Yeah.
Okay, now doctor, we will play a quick game and I will tell you some cases and you need to tell me which test you need to choose for this patient.
Okay, can be a combination also in case, eh?
Yeah, simple case. Don't worry now, not... Okay, so let's suppose the case one. A young person, have experience with experienced palpitation twice a week, but their ECG is normal.
Holter.
Directly.
Yeah.
Holter, okay. Case 2 now. A patient He developed a chest discomfort only when walking quickly or decreasing or increasing a stair.
Mm.
Only
For
this.
this kind of patient, we have to make all. ECG, clinical examination, echo, and maybe stress
All.
test. All. Yeah.
Well, okay. And KJ3, and it's very popular, an athlete, but he feel lazy when he do intense exercise.
Every single athlete, professional or not professional, I advise every 6 months or yearly, they have to have full cardiovascular assessment. This is for safety. Because athlete heart, people, as you say at the beginning, I remember, they think athlete heart is healthy heart, strong heart, but it's not like that. I mean, there are specific characteristics for athlete patient. I mean, the mechanical function of the heart, the muscle, will make some change according to the physical condition, and a lot of change will be inside the heart. Then it's very important for them make the checkup, and for athlete also they never must stop to do exercise. Even if they are with the time getting older, they have to make like a plan for decrease like this, because this together with genetic, with secondary causes, they can develop complicated cardiovascular disease for sure.
Okay. And case 4, and maybe sometimes I have it. When I travel and we will take the plane, when the plane is fly, I have like my heart is complicated, you know, it's something click on my heart. So I need to detect before I travel? Or this is normal thing because
This is
the
normal
plane.
thing. Your body.
Sometimes I have
When you are going up by physics, by gravity, by a lot of physical environments, your body will suffer physiological some change to make you resistance to that pressure or to that change. Then, if you are a healthy patient, okay, no problem. You will have the change.
This is what I'm thinking. I'm healthy and
Yes.
I feel pressure. What about the people they have?
But that is why it's important. If you have any other condition, you have to be clear. I mean, be safe. Always. That is why we are giving orientation all the patient over 40, 50. Check your heart and be safe.
So before we finish, I want to ask you the last 3 questions is very important. What's the most mistake the people they do it with their heart health?
All of us, we think we are healthy. We don't need to go to check our health,
You
our
mean me,
heart.
doctor?
Yes, even me,
Okay.
as a doctor sometimes, you know. Then take care of your health.
Yeah.
Go to make yearly assessment, check your heart, check your general health, and be safe. Only that.
Yeah, this is the important. I think when you don't have a symptom,
Yes.
I'm healthy. So, what is the one simple habit for everyone they need to follow it to have good heart health?
Nowadays,
one habit you need to follow it.
Yes, nowadays the most important thing is the diet. The things you are eating. Because exercise, we have to make balance with the diet to get the gold standard function over our body. And if you will go to media nowadays, you will see a lot of doctors speaking about this diet, that diet, or that lifestyle. And we have different cultures also. The food is different.
Different. For me, I like sugar.
Then we have sugar. Even our government here in Qatar nowadays, they are making some regulation for get healthy, because Qatar government is very, very powerful and strong with the health of the population. And I'm happy with that, because now there are some steps we have to follow to get healthy and be safe in our community here. That is the most important thing. 2 things: diet, and make the physical activity together with the diet when it's the proper moment to do it. Yeah.
Okay. And the last question is, what's the symptom and the most dangerous one? When I feel it, and no need to ignore it or make delay. I need directly to go to the cardiologist.
Every patient everyone, any kind of patient, dizziness, weakness, palpitation, chest pain, tachycardia, burning sensation of the chest, pressure over the chest. This can be resting or with exertion also. In any kind of this environment, if the patient feel like that, he need to check. He need to check.
Everyone, they need to come.
Everyone,
All we
everyone.
feel
Yes,
it.
everyone. Yes.
Okay, Dr. Erick. Thank you, Dr. Erick, for your making the cardiology is very easy, clear, and friendly. And
It's
I understand now why you really want to be a cardiologist.
well, as I told you in Spanish, when I was a child, I always liked the science, the medicine, and in my family I was checking a lot of things, disease and things you have to suffer, to be exposed to stress because that condition.
Yeah.
Then since that time, when I was in the schools, I was checking my heart rate with my colleagues and making comparison, and I detect some difference, you know. Then
Yeah.
I pushed my family to take me to the doctor like that, and there was something. At the end, I became a patient, and since that time, 5 years old, I decided to become a doctor in cardiology, and alhamdulillah, until now, you see, I'm a doctor cardiology. MashaAllah.
MashaAllah,
Thank
Doctor.
you.
Wallah, very perfect, Doctor.
Yeah.
Thank you, Doctor, for all this information. Really, we are very happy to have you in Eden Health Podcast. And thank you for everyone. And you need really check your health. Don't do like me. I feel, I think I'm healthy, but really, I'm not waiting until the symptom is come. But thank you so much for watching Eden Health Podcast, and see you for the next episode.